Okay, we're gonna do TVA, deep core activation, how to turn it on and strengthen the deep core. But you should have first seen the video on the deep core. What is it? Where is it? That video reviews the anatomy. That's really important to be able to properly turn on Transversus Abdominis. And let's do that now. So I'm gonna ask that you lie down. If you don't need a pillow, don't use one. I'm using it for teaching purposes so I can speak to you more clearly and you can hear me. But ideally, go ahead and do this without a pillow. Just make sure that your neck is long and your chin is tucked. So go ahead and lengthen your neck now. Chin is tucked. If you need a pillow for your neck, maybe that's okay too. But if you don't need it, no pillow. Your knees should be bent up, hip width apart. So you find the bumps, the headlights, I call them, of your pelvis, and that should show you what hip width apart is. Now, before we start the actual 3 parts, I'd like you to look here at my low back. At no time in this exercise, not part 1, 2, or 3, should your pelvis move or your low back flatten. So if you go back to those headlights, the front of the pelvis, this pelvic bone should not move at any time. That's a pelvic tilt. That is rectus abdominis. And we are doing transversus abdominis, the deepest of the 4 abdominal muscles, learning how to really strengthen and keep this deep core engaged without rectus abdominis and while breathing easefully and naturally. So that's going to be a big part of this exercise. So part 1, I need you to go ahead, maybe take your fingers on those big bumps, drop down and in to a central bone, that's your pubic bone. Now, lining this muscle and dropping down to the tailbone. So in your mind's eye, picture your tailbone at the base of your spine. There's a muscle connecting the pubic bone to the tailbone called the pubococcygeal muscle. And what I'd like you to do is go ahead, pubic bone to tailbone, and try to draw those 2 bones towards one another gently. So that drawing together, it's kind of an, it feels like you're pulling up on your pelvic floor a bit. It's just a gentle drawing those 2 bones together. That's part 1, and we're gonna draw those 2 together and hold. Okay, so pubic bone to tailbone together, that's part 1. Part 2 is gonna be transversus abdominis. We're gonna be, in a moment, doing this during an exhalation, drawing the belly button down towards the spine, tightening against the poke without flattening the back, without moving the pelvis. Now, once we do that during that exhalation, I'm going to then ask you to hold that tight and continue to breathe. So you're going to keep this tension and try to breathe in naturally. As you breathe in, your rib cage will slightly open, your diaphragm drops down, and that's going to make keeping this tension a bit challenging at first, but then you'll find the rhythm. That's what you're training here. This is neuromuscular training, re-education. So let's do that now. So if you're not sure how to find that muscle, if you find the bumps again, those headlights, come in and up about an inch towards your belly button. Now you're on the soft part of your lower belly, and here you'll be able to feel some tension. The muscle fibers, as they come inward, they kind of tighten against your fingers here. So when you're ready, you got your fingers in and up an inch, take a deep breath in. Exhale slowly. As you're exhaling slowly through pursed lips, draw the belly button down towards the backbone, down towards the spine, tightening against the poke. Now keep that tight and breathe naturally. Breathe comfortably. Keep that tight and try a nice easeful inhalation. Keep that tight and exhale. Keep breathing comfortably and retightening if you have to. Now keep that tight and soften between your shoulder blades. And if you lost any of part 2, go ahead and retighten. We're just doing part 2. You don't have to worry about part 1 yet. So, okay, now relax. So, what we're doing, we're drawing in and tightening during a long exhalation, which I can't show you, talk you through at the same time. So while I'm talking, you're still breathing out until you get to the end of that exhalation. Then you're going to keep this tight and breathe in normal. Okay, let's try it again, just part 2. Take a deep breath in through your nose. Breathe out slowly through pursed lips while you draw the belly button down towards the spine. In, you're pulling in like putting on tight pants. You're drawing these 2 bones towards one another, towards midline, and tightening against the poke. Tighten against that poke, and now breathe naturally. So you're going to keep this lower belly tight, tight, and breathe in deep, or breathe in comfortably. Don't breathe in deep. Just breathe in and breathe out. Breathe in. Now, if you lost a little, tighten it up again. Double check, is it still tight as you breathe and tighten and breathe. And that's your work in the beginning. Now, if you've got that, keep that tight. Notice, is your neck long and soft? Keep that tight. Shoulders move away from one another towards opposite sides of the room. Keep that tight. Shoulder blades soften. Jaw soft, and retighten if you've lost any of it. Keep that tight and nice easeful breath. Now relax. So your work is going to be drawing that down in, tightening against the poke while you breathe for 10, 20 seconds while you relax the upper body, come back and tighten here. Part 3, the ribs. Remember how TVA attaches on these lower 6 ribs? So it's going to draw the ribs slightly down and back, or down and in, or towards one another. It's just a slight drawing down. You can think of the back of the ribs going into the floor, if that helps. So it's a drawing down and in. Now, you're going to pull those ribs slightly down and in, or push into the back ribs into the floor, but you got to still be able to breathe comfortably, and the diaphragm opens the ribs. So this is where, again, we're practicing. So there is a gentle pushing of the ribs into the floor, drawing down and in, but yet there's still the ability for the ribs to be able to move with the diaphragm. So let's try that now. Take a deep breath in through your nose. Blow, find your lower 6 ribs and blow out through pursed lips, drawing those ribs towards one another just slightly. Imagine the back ribs going into the floor. That's it. Back ribs into the floor. As you breathe naturally, these ribs have a slight tension. Breathe in deep. Breathe out. Keep that sense of tautness. It's gentle. It's not bearing down. It's not pelvic tilting. Your low back doesn't move. You have a sense of the ribs going into the floor, the front of the ribs down and in, but you're able to breathe. That's going to be part 3. So now we're going to put it all together. We're going to take a deep breath in, blow out slowly in a moment. Do part 1, I'll walk you through part 2, part 3. Hold all 3 parts with a gentle tension as you practice an easeful, natural breath. Neck is long, chin is tucked. Let's do it now. Breathe in through your nose. Blow out slowly through pursed lips as you bring pubic bone and tailbone towards one another, belly button to backbone, belly button down and tighten against the poke, ribs down and in, the back of the ribs are into the floor. All 3 parts are still down. Double check pubic bone and tailbone, belly button to backbone, tighten against the poke, ribs are down and back, and breathe comfortably. Breathe naturally, keeping this drawing in, tightening, drawing in and breathing, drawing in and shoulders moving away from one another towards opposite sides of the room. All three parts are still active as you breathe, and you did not flatten your back during that exercise. This is not rectus, just TVA still is on while I talk to you. So double check pubic bone and tailbone, belly button to backbone, ribs down and in just slightly as you breathe. That's TVA, neuromuscular activation. Practice this for quite a while before going to the core progression exercises. Really feel like you can just find 1, 2, and 3 and pull them all on together at one time and breathe easy. When you're standing, remember it's an in and up, and the ribs are down, and you're just breathing easy. So it's a little bit different. In and up in standing, you're going down towards the basement when lying down, and your job is to really feel that tension, easeful contraction while breathing naturally. And there is a quick version, so go check out the quick version of TVA. This one long version I ask you to watch once, but then you can just use TVA activation quick version during your regular program practice. Good luck.